Hello everyone, I'm Dr. Swati and I'm going to present the poster on focused drives on special days can augment the cancer screening during COVID-19 pandemic. As we all know that the COVID-19 pandemic has significantly impacted the routine cancer services globally with the reluctance on part of both the healthcare professionals and clients due to the fear of the spread of infection. During the pandemic at our institute as well, the screening was confined to women visiting OPD for other gynecological complaints. Special days of the year like International Women's Day, Cancer Day, or the Breast and Cervical Cancer Awareness Months can be utilized in this scenario to focus attention on preventive care services, and this can act as a catch up strategy. The objective of the study was to assess the feasibility of safe screening of the women for the pre-malignant lesions of cervix and breast, and also to create awareness about breast and cervical cancer preventive strategies amongst the women during a 3 days campaign on the occasion of International Women's Day. So we invited women aged 30 to 65 years for breast and cervical cancer screening on a walk-in basis without any formal registration or scheduling an appointment. A promotional campaign on social media, including Facebook, Twitter, WhatsApp groups, banners, posters, was started 5 days prior to the event. So in the image 1, you can see the banner which we created for this event, and the image 3 and 4 shows the screenshot of our Twitter and Facebook post. A poster making competition was also held for medical and nursing students, and in image 2, you can see some of the award-winning posters. The women who had been previously screened in last 3 years were excluded. All the participants of this study were screened for signs and symptoms of COVID-19 before entering the healthcare facility and were required to maintain physical distancing, wear face masks, and practice respiratory and hand hygiene. The healthcare professionals involved in offering the screening services were required to wear level 1 personal protective equipment. The examination rooms were sanitized in between the cases. The breast cancer screening was done by clinical breast examination, and the cervical cancer screening was offered by cytology, primary HPV testing by HC2, or by visual inspection by acetic acid. The women were also educated about breast self-examination and HPV vaccination. So coming to the results, we saw that total of 214 women participated, including those who had previously cancelled their appointments because of COVID-19. The mean age of the participants was 39.4 years. All women underwent clinical breast examination for breast lumps and were found to be negative. The cervical cancer screening was done by primary HPV testing in 119 women, co-testing, that is HPV with cytology in 36, cytology alone in 24, HPV with VIA in 34 women, and only VIA in 1. We found that 24 women were found to be positive on cancer cervix screening on any test, and out of these, 22 were positive for high-risk HPV and 2 were positive on VIA. We did not find any case of abnormal pap smear, though 4 of the pap smears were reported to be inadequate. All the screen positive women received follow-up management as per standard of care at our institute. None of the participants or the healthcare professional involved in this study reported COVID-19 symptoms in the following fortnight. The patients expressed satisfaction with conduct of the program, and their stress and anxiety was relieved regarding the screening. And also, the healthcare professionals were satisfied that they could provide some preventive services during these COVID times. And the participants were also reassured that they have completed their routine cancer screening, and now they need the testing after 3 to 5 years. So we conclude that we can utilize these special days to catch up the cancer screening during these times, while we adhere to appropriate preventive and protective strategies. Social media campaigns can be extremely useful in promoting these services to at-risk population. Thank you.